Well, welcome back to Good Morning Arizona. If you have trouble sleeping, we want to give you some help this morning, especially in light of all the New Year's resolutions that are being set today, right? This is Dr. Bruce. You've got some really great ideas, and they're pretty simple in terms of falling asleep, staying asleep, and getting a good night's rest.
Absolutely. So one of the things that we know is that there are 3 different areas that can affect your ability to sleep at night. One is your body, one is your brain, and one is your environment. The easiest one to fix turns out to be your environment.
Well, what do we want to do?
Well, we want to make our bedroom a sanctuary for sleep. Makes sense, right?
Sure.
So what we want to do is look for things that could potentially be preventing us from being able to fall asleep. Easiest thing to replace or fix is your pillow.
All right, we want to show you one actually real quickly because this is one that you invented.
Correct. This is one that I created myself. It's called the Signature Collection, and it's available at JCPenney.
Okay.
And this pillow in particular is for neck pain. So lots of people suffer from back and neck pain. So when you look, you'll see that across the bottom is a memory foam bolster to keep your neck stabilized. But lots of people don't like to stick their head in a big hunk of foam.
Sure.
So the top is actually a synthetic
really
down.
soft, yeah.
So you can have good ventilation, move your head around, but still maintain that stability across the neck.
And you can get this at JCPenney.
JCPenney.com.
Okay,
Absolutely.
all right. $39, I think, is what you said.
Yep.
Okay, so we've talked about the environment, and I was joking around and said, okay, because I never sleep. It's one I don't know why, I never have. Just I don't know why.
Yeah.
But counting sheep has actually worked for me. But you say you have a different technique that works as well?
I do. One of the things that I tell a lot of my patients is, in fact, you can actually count backwards from 300 by threes.
Whoa!
I know nobody told you there was going to be math this early in the morning.
I don't know about that, but you know what? Is it because you have to try so hard to figure it out as you go?
You can't think of anything else, and it's so doggone boring, boom, you're out.
Okay, that's a good one. What else?
Other things we have to make sure of is that our body is physically comfortable enough. So one of the things that I always do, besides looking at the pillow, is look at things like temperature. So, you know, here in Arizona, it can get pretty warm during the summer, and it still can get a little cool this morning. It was pretty cold this morning when I came in.
I agree.
So you really want to keep that temperature at a stable temperature, somewhere between about 65 and 75 degrees if you can.
Sure.
That will allow the body to maintain consistency, which allows for better sleep.
Now, because you see a lot of people who do have
do.
trouble sleeping, what are you finding is the most common cause of, I don't know if you call it sleep apnea. I mean, is that what you would call it?
Well, there's a lot of different things that I treat. So I'm local here in Arizona, and at my clinic, one of the things we treat is sleep apnea, which is where people stop breathing in their sleep. But then there's also insomnia, narcolepsy. There's a whole host, believe it or not, 88 different sleep disorders that are out there. But the number one thing that I have a tendency to see is snoring and sleep apnea and insomnia.
And is there like a power down hour or anything like that?
There is. So I actually created a technique called a power down hour. And what I do is I ask my patients, look, an hour before bed, that's when you start getting ready for bed. Because, you know, sleep is not just this on-off switch that you walk in, turn off the light, boom, you're out. It just doesn't work that way. So you have to allow your body time to do it. So I say 20 minutes, do whatever it is you absolutely positively have to do, right? So in our house, it's getting backpacks ready for school, finding shoes, things like that.
Sure.
Then 20 minutes for hygiene. So maybe it's a hot shower, maybe it's getting ready for bed in terms of brushing teeth, washing your face, things like that. Specifically for women, they should have taken their makeup off long before they're getting ready, because sitting in front of those bright lights actually makes you more alert.
Oh.
And then a final 20 minutes for meditation, relaxation, kind of daily reflection, things like that.
And what about the glass method?
So my glass method is kind of interesting, and it would have worked for people last night, and it's called a glass for a glass. So for every glass of alcohol that you drink 1 glass of water.
That way you stay hydrated.
Stay hydrated, and it lowers the overall alcohol consumption, because while alcohol might make you sleepy, in fact, it keeps you out of the deeper stages of sleep. And so, in fact, it's not very good for sleep.
Okay, last but not least, are you a fan of naps or no?
I am. I'm a big fan of naps. I like naps. But naps are great for people who don't have insomnia. If you have insomnia, napping is about the worst thing that you could do.
Okay. Dr. Bruce, thank you.
Well, thanks for having me. And if people want to get in touch with me, they can find me at Arrowhead Health. And I've got a clinic there, and I see all kinds of patients.
Cool. Well, we appreciate your time. Some good tips, especially for those of us who get up a little early for work, like